using the BNF. If you see a drug listed that is unfamiliar to you, you should identify the drug using the British National Formulary (BNF). This drug reference book is adhered to by all healthcare professionals responsible for dispensing, prescribing, and administration of drugs in the UK. Both generic and drug brand names can be found in the BNF. It contains drugs that are licensed by the Medicines and Healthcare Products Regulatory Agency (MHRA) that regulates medicines in the UK. The BNF is a brightly coloured paperback book that can be found on your OSCE drug trolley as well as other healthcare settings. There is an adult and child version. You will get the adult one. The BNF reflects current best practice as well as legal and professional guidelines relating to the use of medicines. It gives a great deal of information about dosage, indications, contraindications, and side effects. It gives concise explanations of each drug, the form it comes in, its therapeutic effects, its diverse indications, and the current dosage in relation to that indication. Also listed are each drug's side effects and contraindications. This information should be explained concisely to the patient so that they can make an informed choice when taking the medication. In explaining side effects as well as therapeutic effects, you obtained informed consent. Published twice a year in March and September, UK healthcare settings have the most up-to-date version of the BNF available. When using the BNF, it is necessary to be able to find the page with the drug on and quickly decimate the required information. The last pages of the book have the index where drugs are listed alphabetically and page numbers show how to find them. Prior knowledge of the layout of the BNF book saves valuable time looking up a medicine and finding the information required. Contraindications. Particular medications present further safety issues in relation to their current medical condition. Nurses must know the drug effects on their patient currently. Any doubts should be verbalized to the examiner. The patient may have medicines from home prescribed on their MAR that may now be contraindicated due to their current condition. This may now mean the drugs in fact worsen their condition. These contraindications must be identified. Use the BNF. Communication in administration. Although you are interacting with a mannequin, you should be able to explain your actions clearly, as you should in each stage of the patient's journey. Throughout the station, you must verbalize everything so the examiner can follow what you are reading on the Mars chart. This is done in addition to your communication with the patient about their medications, but not repeating what you've already explained unless you think they didn't understand. Any conversation and questions directed at the patient will be answered by the examiner on the patient's behalf. Expect this patient to be cooperative and oriented, even if they have not been previously in the assessment station. Although they are not expected to refuse medication, you should be able to give an adequate explanation why they should take it. Relate clearly to them how their medicines will provide symptom control or help stabilize their condition, and a rationale if they are to be withheld. You must be able to list a couple of common side effects of the drug to the patient as well.